box, then we can go through those at the end as well. And I've forgotten what the other thing I was going to say.
Recording.
Sorry, recording. Yes, well done. Well done. Thank you. If everybody's happy with it, we'd like to do the recording of the show. But if anybody's got any objections, please let us know now, and we'll respect your wishes, and we won't record. It's just so that there are some people who would have liked to have attended, but they couldn't. So the idea was that if we could record it, then they can access it afterwards. So unless anybody raises any objections, we'll pursue with the recording.
Yeah.
Yeah.
I'm doing recording in air. Salma, I think I've allowed you to share your
Brilliant.
screen.
I have access now. So if I could just ask everybody, you can see my screen and my presentation.
Yeah.
Oh, sorry, it's not recording.
Let me know when to start, and I will start.
Sorry,
when you're recording.
it is recording. If you unless you say no. Nobody's
Okay,
saying no. Yeah.
No, everybody's saying yes.
Excellent. Right. Okay. Yeah. Okay then, Corinne. If we record, then please.
So hello everyone, my name is Salma Mehar. I'm a consultant dietitian, and I currently work as a consultant in a transformation diabetes program in Northwest London. And today I'm going to talk a little bit about the dietary considerations in diabetes care, with a particular element looking at how we offer care to people with type 2 diabetes from the ethnic minority communities. So this would include the BAME communities, including South Asian, African and the Caribbean communities as well. But my interest also lies with supporting Arabic communities. So I'm going to extend my work across this community as well. So today I'm going to be covering the awareness of diabetes in the ethnic minority communities. So how we engage and how we improve awareness, some of the barriers to access and engagement. I'm going to share with you some of the pictorial resources and the dietary resources that we've developed. I'm also going to talk a little bit about the digital era that we are in and how we are using this to support people with type 2 diabetes and type 1 diabetes. And a little bit about mind and well-being, particularly focusing around COVID and the current climate. So just to show you a little bit of the demographics of where I work. So I currently have been employed to improve the care of type 2 diabetes across 8 CCGs. And we currently have 150,000 people living with type 2 diabetes in Northwest London. We know this figure is slightly higher in the last year, where we've not had as many people coming for their reviews or their blood tests. And in Northwest London, what we know that there is a high prevalence of type 2 diabetes with poorer health outcomes. Sadly, in Northwest London, we have some of the worst outcomes in the country. And we also have high level of deprivation and childhood obesity. So my role becomes extremely challenging with all these challenges, as well as some of the demographics that we face as well. So just to give you an example of one of the boroughs that I cover is Brent, and Brent is very famous for its football, but apart from its football, it's very well known for its diversity and culture. And in Brent, there are more than 149 languages spoken. And the 4 ethnic minority communities that are higher prevalence of in Brent include the African, Caribbean, Arabic, and the South Asian communities. So my challenge was to ensure that these communities are receiving dietary information which suited their needs and their cultural needs. So over the last 10 years, I have been working endlessly with our teams to look at how we can best meet some of these needs and some of the challenges that we are facing. So with my interest in diet, I have been very fortunate to work with a very close colleague of mine, Dr. Joan St. John, who is a GP with a wealth of experience in diabetes. So together, myself and Joan came together 10 years ago and wanted to see how we could improve the knowledge of people that we were seeing in terms of the cultural foods that they were eating. We started our journey 10 years ago where we developed a booklet ourselves, taking pictures of foods that myself and Joan were very familiar with. Joan comes from a Caribbean background and I come from a South Asian background. So with our knowledge, we started putting our thinking caps together and creating a library of images of foods that we would have on a regular basis. We created a library of over 1,000 images, and then we took this library to various organizations to see whether they could support us in developing a resource. And then 3 years ago at Diabetes UK, we approached an organization called Carbs and Cows, and we asked them why they didn't have any resources for ethnic minority communities, because the general carbs and cows are very generic towards the Western diet. And as the demand and the number of people with type 2 diabetes is growing in the ethnic minority communities, why is anything not being developed for these communities? So they actually asked us to do the work for them. And myself and Joan worked with Carbs and Cows on this project for 6 months. So my kitchen was turned around into a studio. And my children had to walk around lots of wires all day. We had lots of umbrellas and lights and cameras pre-COVID. And we actually cooked most of the foods ourselves because we needed to know what ingredients were going into these foods in order to calculate the nutritional values. So over 6 months, we did a lot of cooking, a lot of photo shooting, and then a lot of calculating nutritional values based on the weights of foods that we had photoed. And we were very fortunate enough to get the book together within a year and present it at Diabetes UK conference. From there onward, it's been an amazing journey for both myself and Joan. We have now distributed over 2,000 copies just in London to people in our diabetes transformation program. Just to assure you that this work what I did was done for NHS and I make no money or any royalties from the book. It was solely to improve diabetes care. So they have sold over 10,000 copies of the World Food Book, and it has got international presence in India, Pakistan, Kenya, and in Bermuda. So how the concept started. Many years ago, myself and Joan were thinking of how we could simplify the concept of carbohydrates to a lay person. So for somebody like me who's been doing carbohydrate counting for 20 odd years, I have been very fortunate to deliver Daphne education, Desmond education, expert education. I can tell you from the back of my head how many carbohydrates in any foods you put in front of me. But for a lay person to then be challenged how many carbohydrates they'll be eating in a day is quite a difficult thought process. So we wanted to simplify the numbers into things which meant something to people. So for example, if a banana has 17 grams of carbohydrate in comparison to a larger banana which has 30 grams of carbohydrate, what does that mean to somebody who's eating that? So we decided to come up with an icon which represented 5 grams of carbohydrate in that food portion to help them understand what that food was doing in their bloodstream. Rather than saying, if you eat 50 grams of carbohydrate, your blood sugars will go up, we actually simplified it down to what 50 grams would look like in your bloodstream, and each molecule representing 5 grams of carbohydrate. This then went on to spiral to what we should show different portion sizes as well. So if you replaced your large portion of plate with a small portion, you actually can make a significant drop in your blood glucose, and there is less blood glucose icons in your blood vessels. And this concept has become very popular in a lot of teaching programs. Just to add, we also included foods which are commonly eaten across all communities and diets and not culturally specific, because we wanted to show people that even everyday foods such as bread, potato, pasta, rice, and noodles can also have an impact on your blood glucose. Many a times when I was sitting in my clinic consultation with people from different ethnic minority communities, the first thing they would say to me, but I don't eat any sugar. But I don't take any sugar in my tea. So why is my blood glucose high every time I see you? And this was a typical conversation with every person coming into the clinic room. And then I had to explain somehow, what carbohydrates were. And a lot of that language and that information has been simplified into pictures. We then created meal plans to show people how much carbohydrate they were eating in a day and what they should be reducing their carbohydrates into. So just to show you, we went on one step further to show people how to balance their meals by not just reducing their carbohydrates, but what foods they could replace it with. So visually showing people culturally ethnic food meal plans, which actually showed them reduced portions of carbohydrate, less impact on your blood glucose, and what foods you can actually replace in order to your plate to look more appealing. Because what we didn't want to hear is when I reduce my portions, I'm not full, I don't get full, or my plate doesn't look full. So these were all sort of behavior change models that we created to support people who were living with diabetes. And then it didn't end there for us. Even with people with type 1 diabetes who were from the ethnic communities and did not have any information in their resource packs on the type of foods they were eating, they wanted to know how a rice and curry or chapatis or doklas or dosas, cultural foods, how much carbohydrates were in them so that they could better estimate the amount of insulin they needed to give for the carbohydrate intake.
Salma, I'm so really sorry to interrupt, but it seems that it's not being recorded. I understand you have the control. Are you able to?
The only control I have is you are screen sharing or stop video. Oh,
At the bottom of the screen, you
No,
see a round button here, recording.
Abdul, it is recording. I'm recording it.
Oh, sorry. I kept getting messages that it's not recording. So okay,
Well,
sorry.
it says I'm recording it.
Okay, my sincere apologies. Sorry.
that's okay.
Salma,
That's okay. I would have
not-
started again for you if you wanted me to.
Oh,
So
bless.
I'll carry on.
Okay,
So,
thanks.
and for any reason, if it's not recorded at the end, I'll come back next year.
Oh,
So,
that'd be
right,
great.
moving on. We wanted to show people that meals could look colourful, culturally, and they would be more balanced if they just made some simple swaps or some simple changes without having to completely change the type of foods that they were eating. So just to give you a flavour here, I mean, we wanted to represent foods that people were eating at home, and also what we had asked communities to actually show us how they would dish out food on their plate. We had a lot of people from the community come and work on this project with us to show us actually this is how the plates are served, but maybe you could put it like this, which might be a little bit more acceptable. So the whole booklet has actually been a community development, and it's not just all credit to myself and Joan. So just to give you a flavour of the book, this is what some of the pages in the book look like. And we wanted to show people that even when they were not eating sugar, their blood sugars could be significantly high if they were eating too many carbohydrates at one mealtime. We didn't want them to stop eating the foods that they enjoyed or they had with their family, but just by reducing the type of foods, they would actually make a significant difference to the amount of blood glucose that was going in that was increasing at each mealtime. We also created a library of ethnic meals for healthcare professionals who were not familiar with ethnic meal plans or plates. And we've now put these all onto our website where people can learn more about ethnic communities and the type of foods they have. So we've not just developed a resource, we've actually improved people's education, we've improved people's engagement, and we've also opened up a new way of working, which is the pictorial way rather than the old way of giving people lots of literature and written information. Now I'm going to move on to activity, because this is a subject that often gets missed and not always spoken about, and particularly around COVID. So as we know that it's really important for us to exercise, and how do we get the exercise if we're shielding, and the benefits of activity. So we've done a lot of work with our communities, and we find that there are lots of communities who might not necessarily be taking part in exercise. It's culturally not acceptable, or culturally they don't think it's important to do the exercise. But what we have seen in the last year, that exercise plays a huge part on our well-being, our mental health, and our diabetes management. What we know is that in combination of exercise and diet, this can assist with weight loss, but exercise alone will not assist with weight loss. So how do we enjoy exercise, and how do we increase the amount of exercise that would benefit and improve our diabetes care? So these are some simple plans that you can do in order to increase your activity levels. So whether you are shielding or not, you need to find an activity that you enjoy. It's not about going to the gym. It's not about swimming. It's about something that you enjoy. Lots of people have been saying to me that they have joined an online class and they found a new community that they've really enjoyed. They have been going out for a walk, which they might have not normally done. And because there's been more emphasis on walking, people are now taking up regular walks. You need to plan your day and your week so that there is some time for exercise. Try to make it social. Like I said, that there could be online support at the moment. There are lots of things on television. So for example, Joe Wicks, and there are lots of new apps which are becoming very, very popular. So for example, the 5K to couch exercise, or the XI app, which is free of charge at the moment. So it's just a case of navigating what suits your need. You don't need to have expensive equipments like exercise machines, and it can be as simple as joining a walking club. And I know there are still walking clubs that are running, but they might be limited in the number of people that you can walk with at the moment. Start small. If you think exercise is too challenging for you, because lots of people have said to me, I find it difficult, I'm not able to walk, there are lots of other health problems, but there are so many things you can do while you're sitting down on your couch. You can just be doing your arm exercises, your hand exercises. Every little movement counts. This is a subject that has been raised and highlighted very much so during COVID, and we were not really speaking much about this prior to COVID. So we know that 3 in 5 people of living with type 2 diabetes experience emotional or mental health problems as a result of type 2 diabetes. 1 in 5 have used some sort of support or counselling. And we often gets overlooked is depression, anxiety are both very common problems. Now, this can also be a problem because people are living with type 2 diabetes and other people are not understanding of their dietary needs, of the changes that they need to make, the dietary habits, and it often becomes a bit of an anxiety for people of what they should eat, what they should not eat. Can I eat this? Can I eat that? And they don't get the support from the family or the people living around them. So what we would say is speak up to your healthcare professional if you are worried or concerned about your diabetes management. Psychological support. There are lots of self-referrals online at the moment and lots of information that is being provided by NHS at the moment. Sleep is another subject that often gets overlooked, particularly with people with type 2 diabetes. And we're really interested in this because what we've learned over the last couple of years is that people who do not sleep well have poorer outcomes in their diabetes management. And the other way of looking at it is that people who are overweight don't sleep very well either. So it all comes together. So if we think about our lifestyle, our diet, what we're eating, how we eat, the time of day we eat, this can all impact our sleep. So people who are snacking too late at night, who are eating the wrong kind of foods at night, that can all have an impact on your sleep. The benefits of sleep is that it can improve your energy and your concentration, your learning, and also your overall health. And that's what's really important in diabetes. We no longer see it as a disease of the diet or disease of managing with your medicines. It is very much a well-being, and it's a condition that we need to rethink about how we are actually managing and talking to people living with diabetes. So how can you improve your sleep? Routine is very important, as simple as it sounds. A regular timing to go to sleep. Also getting some morning light, so 20 minutes outside each morning can improve your sleep. And not to drink too many caffeinated drinks, and try to reduce the caffeinated drinks to later in the evening. This is a really, really, really useful one, and I've really tested this out. So many people go to bed looking at their screens, their phones. What is so important than your sleep? And if you can avoid using your phones before you go to sleep, that will improve your overall sleep. And then the usual things like keeping your room temperature as cool as possible. So relaxation is also very important during this period as well. We know with COVID, people have been very anxious, very stressful time for a lot of people for one reason or the other, whether it's your health, whether it's your business, whether it's your family, your children. In many ways, COVID has impacted us. And there are a few simple techniques that we've been talking to people about. They might seem very, very simple, but if you put them into place, you might actually find that your moods and your well-being is improving. So first of all, is give yourself a little bit of time. Now, there are some people out there who are constantly working, constantly on the move, looking after the house, the family, the children. You just need to relax and give yourself a little bit of time. Digital detox. There's a lot of evidence that we are spending far more time on our phones and our gadgets than we would do talking to somebody. So if you can come away from your phones and actually speak to people around you, that is going to relax you. Keeping a gratitude journey. COVID has taught us to be grateful for things that we were not actually thinking about before. And the simple things can actually improve your moods and your relaxation as well. And then lastly, trying to be still, meditation, yoga can also improve your moods. So with respects to diabetes care, we are no longer thinking of just diet, medication and exercise. It is very much a well-being and also improving one's emotions and well-being so that you are more connected with the outside world. We don't want to isolate you as being a person living with diabetes. You should continue to enjoy doing all the other things that anybody else would be doing. And lastly, this is something that we've all heard in one form or the other, is setting some goals for yourself. So these don't necessarily have to be weight loss goals. They don't necessarily have to be changing a diet. They could be increasing my motivation, my wellness, my well-being, my sleep. There could be so many other factors just to improve your overall wellness in order to improve your diabetes care. What we want to remind people that there are so many other things that they could be thinking about rather than just worrying about what to eat, what not to eat, in order to improve their overall well-being. The best actions include what to do and when to do it. Now I want to talk just briefly about our digital solutions in diabetes care. So as we move on to a new era, we've learned that we will have to change the way we teach and also change the way we offer support to people living with diabetes. As I gave you the figure earlier on, we have over 150,000 people living with type 2 diabetes in Northwest London. With the NHS resources being even more stretched, we've now realized that we can reach out to hundreds and thousands of people through diabetes solutions through our No Diabetes platform. And this is where we are offering all our support and resources. So if you were to go onto our No Diabetes page, we want to empower people to learn about their diabetes, to better manage their diabetes, to lose weight, and also to improve their well-being and their moods. We've also created a cultural site. We've dedicated a site for people from the ethnic minority communities with more relevant pictures, images, and dietary literature. So the meal plans will cover cultural meals, whether this is a low carbohydrate meal plan, whether they choose to do intermittent fasting, or whether they choose to do fasting during Ramadan. All the literature that is culturally relevant and culturally appropriate is on our No Diabetes website. We also are moving on to an e-learning platform rather than a face-to-face learning. We know that historically people are referred to programs such as Desmond and Expert. Attendance has always been very poor, and the number of people that should be attending don't often attend. This could be due to multiple reasons. People cannot take time off work, the places of the program is offered is not accessible, it's too far, it's not the right time of the day, they have other family commitments, and we want to encourage people to self-manage their diabetes by learning about diabetes by going onto the e-learning platforms, which is free of charge for anybody who wants to learn more about their diabetes. And this could be type 1, type 2, gestational diabetes, and even those who are at risk of developing type 2 diabetes. Thank you very much for listening. And if you have any questions, I would be more than happy to start a discussion.
No, no one asking a question? Anybody?
I've got some on the chat room if you'd like me to.
Please.
Yeah, I think let's begin with those then, please.
Yeah. One or two people asking if they can have a copy of the recording. We'll try and sort that out. I will have a copy and then I'll have to try and send it to people. But I really need people's details.
Yeah, that's okay, Corinne. I mean, if you know, if people who got my details and they want to get a copy of me, I'll do that. Either forward their details to you or vice versa. We'll sort that out one way or the other. Yeah.
Yeah, that's the only question at the moment. Is it being recorded or can they have a copy?
Right. Okay.
Stephen, can I ask a question, please?
Yes, go ahead.
So I've just looked at the No Diabetes website, and it talks about people living in northwest London, which I fully understand, but it talks about people based in northwest London. But I assume that that's where your studies have been focused, but it's applicable to everybody in the UK?
That's a very good question. So the reason why we say people in northwest London, because as we move on to the digital era, we are going to be monitoring, people are going to self-monitor through the website. And I thought I had this, I had a slide where I could show you what it would look like. So anybody can use our resources. So if you have a look at the website, you can access any of it's open to anybody. We've had lots of people around the globe using our resources. We have people from different countries accessing our dietary information. They're looking at the different languages that the videos in different languages. In terms of registration, what that means is that the digital era, we are moving towards a digital monitoring diabetes management care. So you will be entering into a platform onto the No Diabetes website where you will be having a screen which will show your, I'm going to see if I can get a presentation up which will show you what it looks like. So it will help understand what the it looks like. Okay, so I will just share my screen. So if I can take you to my screen and show you this particular site. So people who, can you all see my screen?
Yes.
Yeah. So basically what this means is online records access for people with diabetes. And this is already running in Scotland. Scotland are always ahead of us in terms of management and care. It's also available in Manchester, Somerset, and some other areas. And what we plan to do is we will ask everybody in Northwest London, so the 150,000 people living with type 2 diabetes, to come and register on the No Diabetes website. When they have registered, they will have access to their health records from the GP practice on the No Diabetes website. So you no longer will have to go to your GP practice to see your medical records. So everything that the GP sees, you will be able to see. So we want openness in people's care. You will be able to see the results of your last blood test. You will be able to track what your history of your blood tests are like. And if anything is flagged up as red, so you can see the circles here, in your last blood test, your cholesterol was high, it will immediately alert you to the website that has information about cholesterol. So you don't have to go back to your GP and say, what do I need to do? So the idea is all about self-management. So you will be able to get that information on the website rather than having to ask the GP about every little thing. So whether it's your blood glucose, your blood pressure, your cholesterol, everything on the website will be linked to your health profile. The other benefit of this is that you can track how things are going. So even your medication, so if you are on metformin, if you click on the metformin, it will give you a whole open information about what metformin is, what the side effects are, what it does, what are the benefits, and the same with all other medications such as gliclazide or insulin. So we want to give you as much information as possible at the click of a button at home, so you don't have to keep queuing up or going into the practice and asking them about things that you can self-learn and self-manage. And that is the beauty about digital interventions, is that we can reach out to more people. And you will also get an alert if you've missed your retinal screening, your blood glucose, your diabetes review. And this will be a good alert to tell you when was the last time you had your blood test and when is your next blood test due. If you are in target, it will also say to you, did you know that if you continue to be at a certain level of HbA1c, you can actually achieve remission of your type 2 diabetes. So it's a very, very clever tool that we are using, we're implementing in Northwest London so that people can self-manage. And particularly for those people who work long hours, who don't have the time to go and see their GP practices, they can do everything remotely. We'll be doing remote consultations over the phone, over Skype, so people can speak to their GP if they're not able to take that time out for that appointment. And this is going to revolutionize the way we offer diabetes care through digital platforms. And at the moment, there are lots of areas who are starting to offer this. It is a big project. It's taken us a good couple of years to develop this website, but it's also been a very successful website in terms of developing any resources that we think our community would benefit from. We've been able to give out COVID information. We've been able to give out information on the vaccinations. So we send out emails to people who register on a regular basis. And that's the only thing about the Northwest London community. However, because the model is so successful, lots of other CCGs are following this model and want to learn from our success and want to follow this model of care. And I know lots and lots of CCGs are now investing in more digital intervention, because we just can't reach out to the number of people with diabetes, sadly, because the numbers are rising, the number of staff is not rising, and that's why we have to look at new solutions.
I have a question. This information you've just told us about, is it not the same as the patient view? Because I'm a kidney transplant patient, and we have access to patient view that has the results. So when we have our blood test, everything goes onto that system. So will that not be replicating, especially for people who have post-transplant diabetes from the kidney disease community?
So very good question. So it's not, that's a very specific tailored program that you are on at the moment. Not everybody will have access to that viewing as you do, particularly because you have to be monitored so closely. So that's probably why you've been entered onto that. And again, you can see you're using a digital platform, which is working very in your favor to keep a very close eye on all your bloods. And you don't have to keep going backwards and forwards to your secondary care consultants. And that's what we're trying to do, is avoid those unnecessary trips to the GP practice, where we can give people the numbers, we can give you the information. You can either self-manage it by the information, or you can go back to your GP practice if you want more information. So it's trying to bridge the gap where people don't necessarily attend their appointments, haven't got the time, haven't got, their employees are not allowing them time to take the time off to go to their appointments. Or some people in Brent are on very, very low income jobs, and they have 2-3 jobs in a day. They're juggling between jobs, and health is not their priority. So that's why we've created this platform for them.
Okay. One last question. So as a kidney disease patient, I've always asked this, but I never get a satisfactory answer to it. I have to watch my diet Okay, and I have post-transplant diabetes. I have to watch my diet. But the problem I've got is that, you know, what I can eat as a kidney disease patient, I cannot eat it as a diabetes patient and vice versa. So what do I do in that situation if that happens?
So I think what you've got to really refer back to is your renal transplant unit. There are lots of dietitians in London who I know who work in the renal transplant unit and have developed ethnic resources for people from ethnic minority communities who have had a renal transplant. I will say, hand on my heart, I'm not a renal expert. Our website is not tailored for renal dialysis patients or for kidney transplant patients. It is very much a generic website for those who are newly diagnosed and also who are living with type 2 diabetes. This is a very specialist area. You will have to contact dietitians who design and develop specific resources for people like yourself. What I would suggest, if you are on LinkedIn, look for renal specialist dietitian. I've just yesterday saw a post up by a renal specialist dietitian who has created ethnic specific resources for renal patients, and that's the sort of resources that you want to look through. And the only way you will look through that is if you go onto LinkedIn or I can't remember which hospital she was from, but
that was deeper.
It's Gabby.
Okay.
While I'm on the call, I will look up her name, and you can link. You can find her on LinkedIn straight away.
Yeah. Okay. Thank you very much.
You're welcome.
Somebody's asked if this is going to be looked at locally, and the CCG, which is Bedford, Luton and Milton Keynes, are looking at doing some similar resources to this, with working with NHS England and Diabetes UK. I'm sure there is something similar locally, or will be soon.
I think so. And if they want to have a discussion with me, I would be more than happy to come and talk to the CCG. I work as across 8 CCGs. I have been supporting 8 clinical CCGs to improve their diabetes care. This is not just about with one CCG. This is making sure that there is consistency of diabetes care across the patch. And how we do it is through digital interventions, because what we know is that resources are limited across different areas. Services are all very patchy, and the issue we have is that some areas have a very good service, some areas have not a very good service, and people living with diabetes lose out. So if we can improve digital uptake, digital inclusion, because what we don't want is to create more health inequalities by going online and people don't understand how to navigate on these websites. So I do a lot of patient engagement sessions purely to support people how to navigate the websites that we develop. And that's my key priority, is to get it to the people who are not computer savvy, who are not computer literate, but by simple messages and navigation of the website. And once they register, they then get frequent emails from us on how to benefit from the website. And just going back to Hilary, the dietitian who you want to connect with, her name is Gabby Ramlan, Ramlan, and she is a diabetes and renal specialist dietitian in North Middlesex Hospital.
Okay.
Gabby Ramlan.
Gabby Ramlan.
And she's developed a series of resources for ethnic minority communities on renal and diabetes and renal, which is your interest. Yeah.
Thank you.
So if you connect her on LinkedIn, I'm sure she'll be more than happy to connect with you. If you've got any issues, just come back to me, please.
Okay, will do. Thank you.
Someone's asked about a Facebook page. Did you mention a Facebook page?
We don't actually have a Facebook page. I'm just going that the video that we've just recorded can go into your Facebook page, but we don't sadly have a Facebook page.
Okay,
for our work, no.
And also somebody was asking about type 3 diabetes.
Oh, I don't like to talk about that. I don't have the knowledge and the experience. So I focus very much on type 2 because that is where the tsunami is at the moment.
Yes.
And if we don't do anything about it, it's just going to get worse. And even if people do get type 2 diabetes, I think we need to just get the information out there that it's not just about food. It is multifactorial. You know, we need to be a bit more empathetic and talk to people about them as human beings rather than somebody who has diabetes. So we've changed our approach completely.
Thank you.
Thank you. I think we have Steve who would like to make a comment. Yes, please, Steve.
Well, first of all, I'd like to thank Salma for giving one of the best presentations I've ever heard on this particular topic. So thank you sincerely. And secondly, can I thank you for drawing to my attention the No Diabetes tool, which I'd like to think is going to be form an important part of my life in the future. Finally, can I just say that how refreshing it was this evening to actually listen to a presenter who knows how to use PowerPoint as a tool and not as a script, which I had unfortunately had the misfortune of experiencing on a Zoom earlier today. Thank you. It's so refreshing to be able to hear a professional who knows how to use a particularly powerful tool. So thank you for your slides and your clarity. Thank you.
I'm very humbled, really, really humbled by those words. So thank you so much. I mean, it's a pleasure to be here. I always love speaking to groups, and I just talk passionately about what I do, how I do it, how I'd like to expand and offer my knowledge, like Ray said, of whatever I can do to support communities anywhere now, nationally, globally. I am more than happy to speak. So thank you very much.
Thank you.
Oh, you didn't just say that, because I'm going to take you up on that.
You do realize, Hilary, that I'm her manager. You have to pay me first.
I don't charge for any of my talks. So you
could have let me earn a bit of cash while I'm waiting for jobs to happen.
I'll just put in a pledge is that my husband put my name down for some competition. So if anybody wants to give some gratitude, if you could just put my if Rice is going to share my husband's spiel of my nomination, and if you can nominate for me, that would be very nice of you.
Yeah,
oh, that would be great.
I'll be happy to do that. I'll be happy to pass it on to everybody, and would encourage you to be quite honest. I've already voted for her, of course.
Thank you.
With hands and feet, and I've also passed on to as many people as possible. But yes, please, anybody who would like to vote, you've all seen it. She well deserves it.
Yeah,
I'm really proud of her. I'm proud of her as as a friend, and I think she's just a wonderful human being. After giving you that build up, Salma, can I just, one question I'd like to ask, that's to do with childhood obesity. We know that's forever on the increase. Is there any help available in that regard? To help parents understand and deal with the idea. Of course, now we've got added issues through, because of lockdown and so on, with children's mental health and all sorts of other things. But I just wondered if there's anything available on obesity at all.
It's a very valid point. So I shouldn't say this, but for my extra curriculum or out of hours, I've actually been asked to look at how we can support children with type 2 diabetes, which is very, very sad. And we're looking at how we can implement things like climate change, because that seems to be a hot topic with children in improving their type 2 diabetes for children. So at the moment, obviously schools are closed, after school clubs are closed, all centres are closed, so it is going to have an impact on children's well-being, their health, their mental health, and also sadly we might see a rise in number of type 2 diabetes in children. The only thing I will suggest is that please continue to offer your children the foods that you would eat and not a separate meal. So children are not designed to eat chicken nuggets, fish fingers or pizzas. That's not how they were born. I think my advice to families is to offer children the same foods that you would eat, and they need to enjoy and get involved with family meal times. Cooking, we're looking at eating on budgets for families who want to learn more about healthy eating. It doesn't need to be expensive, it just needs to be a little bit more creative. There are lots of free resources online by NHS England, and there's a wonderful website called Change for Life, which is a government campaign for children and families to prevent obesity. Obesity is on the rise, but at the same time, there's a huge focus on children's activity levels, and the likes of Joe Wicks and sports personalities who are encouraging young people to be fit at home. If you are indoors, then all I can say is to go online or join any class on YouTube. You don't have to pay for it. Everything is free, but it's just encouraging children to be a little bit more active, getting involved with daily cooking, coming off screen time, restricting it to a certain number of hours a day, and not allowing children, because it's an easy option just to sit in front of a television or put on some form of video console. So there is a bit of a parenting and also a little bit of behaviour change model going on here. We are looking at working with schools and the government on changing school meal policy. For those of you who might have remembered, school meals all I can remember from school meal is custard and cake or jelly and cake, and those are the things that we want to come away from, that we need to be offering alternatives to cheap meals in schools, and not just for catering companies to make a good profit out of schools. So lots of work that has to be done. I am in talks with an app company to look at an app for type 2 diabetes in young children, and if they do more steps, it's going to be a greener planet. So how we can reward children for doing more steps and also saving the planet as well. So lots of suggestions, but it's really a case of, at the moment, priorities do not lie with childhood obesity. It's very much adult obesity and adult type 2 diabetes because of the admissions in hospitals. So sadly, very little is being done. If anything, I would suggest that people will need to look for services now that they have gone remotely online. There are lots of organisations that support families and their children to prevent type 2 obesity and type 2 diabetes.
Okay, well, thank you very much for that. I think we're coming almost towards the end of the session now, and what I would like to say is, from the bottom of my heart, really, to thank you to huge thank you to Salma, and if you can all raise your hands and clap for Salma, maybe.
Thank you. And I'm sitting in my bedroom. Normally I sit in my office, my children are downstairs. I didn't want them to disturb me, so you're probably wondering why she's sitting in her bedroom. So yeah, that's the reason I'm upstairs, so I don't get disturbed. But thank you for the invite. I really enjoyed
pleasure.
And please do email me any questions or queries if you have in the future. I will drop my email address in the chat box now, and feel free to email me at any time. I would be more than happy to respond to your queries. And if there is a particular CCG query, or they want to learn more about how we are doing our programme, you can email me on my NHS website email address.
Okay, thank you. And
don't forget to vote for me.
Yes, don't forget to vote for her. And also on that note, I'd like to say that Salma is also my guest next Sunday, the 31st of January, on one of my radio shows. Unfortunately, the show is in Urdu, so if you don't understand the language, tough. Alternatively, you've got a week to learn it, and I do teach. I'll give you a crash course if you're interested. But in the meantime, thank you all very, very much for attending, and I hope you found it useful, and we look forward to meeting up with you next time. We'll let you know as through normal means, and if we're able to get hold of another guest, I'm sure we will be, and we'll let you know about that. In the meantime, thank you all very much once again, and thank you, Salma.
Thank you
very much.
Thank you.
Thank you.
Thank you.
Bye. Bye. Bye.
Bye.
Bye. Thank you. That's it.
Okay, is that everybody gone? Yeah, that's it. Excellent.
Yeah.
Okay, I'll put the rice in, shall I?
Yeah.
Look, there's lots of chicken in that, and the rice bulks up. So do you think this would be enough rice? Because what's left in one packet?
Yeah.
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 Oh, we've got 2 people still.
Yeah.
Can you exit them out, or perhaps they've forgotten?
Mhm. Don't know. How to slightly. That's it now. No. Right. Those 2 are just ladies. I put them into the waiting room. So
Excellent. Right, that's fine then.
yeah,
Okay.
that was really good.
Yeah, it was amazing.
Actually, there was 30 people on that one, Abdul.
Wow, fantastic.
So I'm just going
That's
to
really